Wonderful. Good evening, everyone, and welcome to our TeamPeds Town Hall discussion on the impact of racism on children and adolescents. It's so wonderful to see everyone virtually this evening for this town hall. And before I begin to introduce our speakers and introduce some ground rules, I did want to briefly call on our current president, Jessica Peck, who wanted to share some opening remarks. Hi, Jessica.
Hi, everybody. Hi, thank you so much to Rajashree for hosting this evening. As the executive board, we've been looking forward to this evening for several weeks now, and we're very grateful for the collaboration with the American Academy of Pediatrics to make this possible. And thank you, Rajashree, for hosting. As you know, we started to look as an organization at what are we doing to look at child health equity. We recognize, just like a lot of other organizations, that we really could do more. There's a lot more that we could do. And we had a good start with our Diversity and Inclusion Task Force that was last year. And so we're starting to take steps as an organization to do much more in that regard. The executive board did vote last month to elevate that task force to a standing committee on diversity, equity, and inclusion, which Rajashree has been a significant part of that effort, and she may say something more about that later. We also decided to have this town hall series so that we could facilitate conversations amongst our members to start to discuss how these issues of social determinants of health and child health equity impact child health in general. We also are starting our TeamPeds Talks, our podcast series that launched yesterday. You can find this podcast on Spotify, on Google, on Apple. So again, it's called TeamPeds Talks. Our first conversation series is a 16-week series on child health equity. And we looked at Healthy People 2020 and structured our conversations around social determinants of health for children. These apply to primary care and acute care, and we're discussing issues of early childhood education, health literacy, food insecurity, and all kinds of other social determinants of health as listed by Healthy People 2020. These are free to our to members and to non-members. They're free to anyone who wants to access them. This is our contribution to the greater community and discussion. And so you can access those, and there are a series of 16 episodes, and so it will be 8 hours of continuing education that is available for free. If you complete all 16 episodes and answer the 2 to 3 continuing education questions, you will receive a certificate of completion of NAPNAP's curriculum on child health equity. So I encourage you to share those, listen to those, invite your friends to listen to those. We have some really great work that's going on around the country. And with that, I'll give it back to Rajashree, and we look forward to our conversation tonight.
Thank you so much, Jessica. And again, welcome to everyone for joining us. Just a couple ground rules before we get started. The meeting is going to be recorded this evening so that we have it for our members for future reference. We have everyone muted as our speakers will provide their presentation. Feel free to turn on your video if you'd like. It's always wonderful in this virtual space to see one another, but we certainly understand if you'd like to keep your video off. We are going to hear from our speakers first this evening, and then I will be sharing some pre-submitted questions that members sent in to share with our speakers to help answer. And then we'll end the meeting by opening it up for an open Q&A time. So we ask that everyone, again, keep their lines muted. Certainly feel free to use the chat box if you have any questions, any resources you'd like to post, any comments as we go along. We'll do our best to get through as many questions. I know that there's a lot of different aspects of this issue that we can continue to discuss, so we'll do our best to get through everyone's questions. But we will limit questions to at least about a minute so we can hear from as many members as possible. And with that, we will go ahead and get started. So this spring, we had the opportunity to host a town hall on COVID-19, of course, and we heard from several of our frontline members in acute care and primary care, as well as our health policy advocates, to share their experience of reflecting on what that felt like and what we were going through. And we wanted to continue to use that space of this type of a town hall forum to continue dialogue on really important and relevant topics. And so we're so thrilled to hear from Dr. Danielle Dooley and Dr. Jacqueline Douge this evening, two national experts working with the American Academy of Pediatrics to share with us the evidence and understanding of the impact of racism on children and adolescents, and really have a focused discussion this evening on what that means in terms of health outcomes for children. What does this mean for children in their experience and growing up, as well as acknowledging our roles as clinicians and educators and researchers in this process. So we are so thrilled to do this. The timing of this is very appropriate. We are celebrating the 1 year, or approaching the 1 year anniversary of the American Academy of Pediatrics releasing this policy statement from last August. So it is really timely to celebrate that time and see how much we've learned and grown in that time. And so with that, I have the honor of introducing both of our speakers. Again, we're so privileged to have them both here this evening. We'll be hearing from Dr. Danielle Dooley. She is a general pediatrician and specializes in immigrant child health and school health. As medical director of community affairs and population health at Children's National, she provides advocacy education for residents and faculty. Dr. Dooley also participates in a new initiative on social determinants of health resource connection within the primary care clinics. She develops collaborations and strategies to improve population health for children across the institution and the Washington, D.C. region. We'll also be hearing from Dr. Jacqueline Douge, who is a general pediatrician and public health professional. Dr. Douge holds a master's degree in public health from the Johns Hopkins Bloomberg School of Public Health, her medical degree from the Rutgers Robert Wood Johnson Medical School, and Bachelor of Science in Pharmacy from Rutgers University. She's the co-author of the AAP policy statement on racism and its impact on children and adolescent health. In addition, Dr. Douge is the writer of the upcoming middle grade novel, Learning to Love All of Me, host and creator of What is Black podcast, and has served in several volunteer and leadership roles, including currently serving on the Frederick County Public School Racial Equity Committee and chair of the Maryland AAP Committee to achieve anti-racism, diversity, equity, and inclusion. She's also served as the American Academy of Pediatrics Public Health Special Interest Group co-chair, member of the Howard County School Health Council, Practical Playbook National Advisory Committee member of the American Academy of Pediatrics Task Force on Diversity and Inclusion, and past president of the Maryland Public Health Association. And she currently resides in Frederick, Maryland with her husband and 2 sons. So we are extremely honored to have both Dr. Dooley and Dr. Douge with us this evening to start off this conversation. So I will turn the floor to both of them, and again, thank them for being here this evening.
Great, thank you so much, and sorry for the slowness in getting the slides up there. My colleague, Dr. Douge, is going to start us off tonight, and we're so happy to be here. Thanks for having us, and we're looking forward to a great discussion.
Good evening, everyone, and again, thank you for the opportunity to join you this evening. We're so pleased that we're in a conversation to talk about this important topic of racism as a social determinant of health, and how together we can make a difference. Because between your organization and the AAP, we reach millions of children across the United States, and we're pleased to have this important conversation tonight. We want to disclose that we don't have any disclosures to make, and these are the areas we'll cover today in terms of our learning objectives, defining, and then Danielle and I will trade off in terms of the presentation. I'll take the first part talking about defining the problem of racism. So we'll move forward. And as you'll see throughout the presentation, we've really peppered the conversation with books, because we both love to read, and we know that there's an important role that literacy plays. Literature plays, especially diverse literature plays in having difficult conversations, and also affirming differences, and just an opportunity to really explore the wonderful world of the diversity of literature. So first, we're going to just talk about some definitions so that we're all on the same place in understanding race and racism. This is a definition of race from Dr. Kamara Jones. And the essence of it is that race really is a social construct. and we're more alike than we're unalike, right? So really know that there's really no biological basis for the establishment of race. That, again, as the prior slide showed, is a social construct, and there's really only one race, the human race. And the next slide also provides an overall definition of racism, and I've highlighted some key points in this definition. One, what racism does is that it unfairly disadvantages individuals and communities, and unfairly advantages other individuals and communities. So we're really talking about power and privilege, and that's what racism does. So we just wanted to go over a little bit the social ecological model of racism and how it interplays for an individual. So as you can see from this model, there are different levels of racism and different ways that it manifests in our day-to-day lives, in our systems, on the personal level, interpersonal level, in education, in our healthcare field, and our policies, immigration policies, incarceration policies. And just sharing some additional resources that we recommend to do the work of anti-racism. So I will turn it over to Danielle.
Great. So the next part of our presentation, we're going to talk a little bit about the evidence. I think that based on some of the questions Raji shared with us ahead of time, I think this is an area that most people are pretty familiar with, and I'd encourage you to read our policy statement that we wrote, which goes into this really in depth. So we're going to spend a little bit of time on this because we really want to get to the third part where we discuss some guidance on addressing the effects of racism on children and adolescents and really having a discussion. But everyone, I think, on the webinar is familiar with the social determinants of health and the official World Health Organization definition. And, you know, as Jackie was saying, a lot of these social determinants of health are influenced by economic, political, and social factors in a community or in a society. And that's where racism often plays a role in impacting the different opportunities in different communities. And just a reminder of the biological mechanism of the impact of racism on health, which we discuss in our policy statement. But the chronic stress that someone may experience or the traumatic event that they may experience as a result of exposure to racism, whether that's as the victim, even research shows as the perpetrator or as a bystander, you know, can lead to this chronic stress response with the chronic release of cortisol, which really starts to suppress your immune system over time, kick up your inflammatory moderators, and really can impact all of the systems in your body and leading to, in the long term, to more chronic disease. And for anyone who hasn't checked out this wonderful article by Dr. Nia Hurd-Garris and some of her colleagues, we think this is a really helpful diagram just going through how children may be impacted by racism throughout their life course, you know, starting with the maternal experiences of racism and how that impacts child health outcomes, which you can see on your left as you're looking through the screen, and then going through, you know, experiencing racism directly or vicariously and how that impacts child health outcomes and child health, you know, and child success, you know, long-term academic success. So this is a really helpful article I would recommend checking out. And I think, you know, Dr. Kamara Jones really lays out for us that racism as a social determinant of health has to be addressed if we want to achieve social justice and eliminate health disparities in our community and our country. And these are some additional books that we would just bring to your attention, again, on the work of becoming an anti-racist. So we wanted to make sure that we had some of these peppered throughout the talk so that you can, you know, go and look them up, order them, use them for your education. And now I'm going to turn it over to Jackie as we get into the third part of our talk.
We're now going to get into the meat of the presentation, like how are we really going to work to address racism and the effects on children and adolescents. So we wanted to highlight again that this is the year anniversary of the American Academy of Pediatrics policy statement on the impact of racism on children and adolescent health. This policy really outlines recommendations for pediatric providers so we can be prepared to discuss and counsel families of all races about the effects of the exposure to racism, and also help our parents talk to their children about race and racism and advocate on the behalf of our patients and families. A few weeks ago, the American Academy of Pediatrics also released a new policy statement, the Truth and Reconciliation Statement. And in this statement, they're really looking at apologizing for past racial injustices towards African American providers. And also this policy outlines a commitment to updating AAP's bylaws so that the membership is aware that we're an organization that's committed to non-discrimination based on race, ethnicity, religion, sexual orientation, or gender identity. Our colleague, Dr. Maria Trent, is a co-author of the policy statement and was not able to join us this evening, but we definitely wanted to have her voice be represented in this presentation. And I love this quote from Dr. Trent, that racism is a socially transmitted disease, is taught and it's passed down. And for me, this is just a reminder that, you know, when someone asks, why are we as pediatric providers really, you know, addressing racism? Why is it important for us? Well, with any disease, right, we're gonna work to try to prevent that disease, or we're gonna try to find ways to mitigate the effects of that disease. So this quote really kind of puts it into our wheelhouse. We're healthcare providers. This is a disease that has an impact, long-term impact, and also has a health impact. So this is important for us to really be working on. And some additional resources, additional books.
So next we'll get into how you can address racism in your practice and at the individual level, the clinical practice level, and some at the community level. And again, for this part, we're going to be really excited for our discussion to hear from your group about what you all are doing, because I think that while Raji welcomed us as experts, I want to emphasize that I think we're on our own journeys still to figuring out what are the best ways to address these issues in the practice setting. So I think there's tremendous opportunity for collaboration between our two organizations in doing this work. But first, I think at the individual level, you know, implicit bias is something that we need to address in our practices and the way we work. It's the process of associating stereotypes or attitudes towards categories of people without conscious awareness. And it can result in actions and decisions that are at odds with maybe our intentions or our explicit values. So I think it's important to ask, are we as pediatric providers, you know, given the opportunity or making the effort to examine our own biases, because these biases can lead us to make, you know, unfair or biased decisions regarding employment, hiring and promotion. In the education sphere, we see this maybe around what classes students are placed into or which students receive discipline disproportionately. And in the healthcare setting, you know, which treatment options we make available to patients. I know that there are sometimes criticisms of work around implicit bias, saying that it doesn't, you know, lead to organizational change necessarily, but I personally believe that it still means we need to do that work and examine our own individual attitudes and potential biases. And I think that leads us to the work of anti-racism. I hope people are familiar with Dr. Ibram X. Kendi's work on how to be an anti-racist. And I think, you know, his quote is so important, that the opposite of racist isn't not racist, it's anti-racist. And so, you know, what are we doing to address, to become an anti-racist and address the roots of problems, you know, that are in power and policies, and really confronting racial inequities? I think he really gives us an incredible call to action. And I did want to highlight for people that he is hosting a teach-in all of next week. It starts on Sunday, August 14th, and he's hosting it every single night with different authors and experts. You can sign up at this website here, and in signing up, you also receive the book that's related to the topic that they are addressing. So I'd encourage people to check that out, because I'd especially say to my colleagues who are white, you know, we have to do the work ourselves. We can't be relying or leaning on our colleagues, you know, who may be Black or Latinx or other colleagues to do this work for us or to help us through it. We have to really take that ownership of educating ourselves and seeking out these opportunities. And I think there are so many ways to do that. And so I did want to highlight this upcoming opportunity. And now I'm going to turn it over to Jackie, who's going to talk about clinical practice.
Forget that I need to unmute. So when we look at how we practice, right, either our individual practices or the institutions that we work in, we really want to ask ourselves the following questions, right? Are the images of diverse families on the clinic walls and multicultural books, videos, and toys in the waiting area? Are staff diverse and able to deliver culturally and linguistically appropriate services? Are you performing quality assurance assessments to determine if your patients are having similar outcomes regardless of race? What is your practice doing to improve quality when possible? And are you screening for social determinants of health using validated screening tools? And this is important because it really kind of provides a check-in for the work that you'd like to do, right? The aspirational work you would like to do and what you're actually doing. So it's very important that we also look at how we're practicing and how our institutions are meeting our patients. And just wanted to share some resources. The American Academy of Pediatrics has a new podcast series, Reach Out and Read. And this is also an area of focus, a recommendation from the AAP's policy statement about diversifying the children's literature that we provide in our practices. And they offer great perspectives and tips on incorporating early literacy into your practice, and also incorporates the importance of having access to diverse books, as well as books that can be used as a first step in discussing race and racism in your practice. In addition, the Bright Futures, which for many of us is really like the Bible of practicing pediatrics and working with child health, offers resources on how do you integrate social determinants of health into healthcare visits. And if you go to the link for Bright Futures, or you have purchased Bright Futures, there are worksheets and fact sheets to also kind of help you incorporate this into your practice. Some additional resources as well. Many of us as pediatric providers we know we don't have enough time in the 10, 15 minutes that we have with our patients. So podcasts are really great resources. What is Black is my podcast, and it's a shout out. Thank you, Danielle. Where I really talk about tips on how to raise healthy and thriving Black children and adolescents. And our other colleagues, Dr. Lanre Faluse, who also is a pediatrician, and Dr. Lisa Bargol, I maybe pronouncing her last name. They also have a podcast, and I would happen to be a guest, as well as our other colleague, Dr. Nia Garris, on a series of episodes talking about how to help families talk about race and racism.
So I think too, in our practice, we, get a lot of questions from parents and caregivers and have this incredible opportunity, to meet them in the space of our practice, whether that's now virtually through telehealth or in the office. And so we wanted to talk a little bit about interactions with parents or caregivers. First of all, reminding people, how early distinctions can start based on appearances, and that by ages 2 to 4, children can start to internalize racial bias. So making that early work that we're doing with children and families to address race and racism, incredibly important. And that's both through, as Dr. Douge was saying, she's being a little too modest. I need to share with everybody that she emailed the Reach Out and Read leadership and offered to work with them to develop a more diverse set of books that's available for practice to purchase who are participating in early literacy programs. And that's going to be, that updated list is going to be coming out later this year. Dr. Douge worked with them, put together a group of us who reviewed probably about 50 different additional titles to make recommendations for what they should include in their catalog, as well as it will come with tips for pediatric providers about how to use those books to talk to families about race and racism, as well as addressing the importance of why, if you're in a provider who may have a practice that has a majority white population, why it's still important for you to have a diverse set of books in that practice. So be on the lookout for that coming later this year. I think too, it's a reminder that, kids are really encountering racism and learning about racism in many ways outside the home as well, from TV, from school, from interactions with friends, families, and neighbors. So it's incredibly important that our practices offer a space to support families in talking about and addressing race and racism. These are a couple of great articles that you can use as you're counseling families or refer them to in terms of talking to children about racism and race. So I definitely recommend reading these articles. Dr. Douge was a co-author on both of them. And I think there's also the question that sometimes comes up about, well, how do we even bring this up with families? And a couple of tips, again, I definitely don't consider myself an expert. I'm still learning, but I think first of all, it's important you're doing your own work, and it's important that you're thinking about how to possibly bring it up with families without, re-traumatizing them or re-triggering them based on experiences they may have had. We do have an opportunity, given the events in our country, the murder of George Floyd, to talk to families about race and racism in our practice, and possibly even you can consider opening the conversation with, how has your family been coping with recent events? What can we as a practice, or me as your provider, your family's provider, do to support you in talking to your children about racism, or in helping them to deal with the experiences they may have had around racism? So I think those are some open-ended ways to start the conversation, but I think that's also the next part of the work after the policy statement is generating, in the same way we have come up with counseling frameworks around obesity and other issues, we need some of those counseling frameworks as well around racism. PBS.org is also a wonderful resource to refer families to, and hopefully many people also saw the CNN Sesame Street Town Hall, which is also an excellent resource. And then these are some additional titles, some of which are also being added to the Reach Out and Read book list. For those of you who are nurse practitioners in primary care, you'll be very familiar with some of the Reach Out and Read titles, so you'll hopefully see some new ones being added to your office collections. And I'm going to turn it back over to Jackie.
So in our workforce and professional education, there are also opportunities for us to advocate for policies and programs that diversify the pediatric workforce and provide ongoing professional education to providers. And this is a resource that colleagues have shared, Race and Racism in Medicine. that provides some resources for individual work as well as group work for practices. And additional training resources for health professionals comes from the Public Health Foundation. And some additional books, many of them award-winning books that are really additional resources for your patients and even for yourself. I enjoy reading young adult and middle grade books as well, so I think they're an excellent resource. And there are also opportunities for us individually or even as practices, right, in terms of how do we do the work outside of our normal practice, right? So there are opportunities for us to engage in the community and advocate. Since many of us may work outside of private practice, we have opportunities that our work sites might be in education, justice settings, or public health settings. So these are great opportunities for us to leverage our roles, right, to advocate for clean water, access to food, housing stability, educational equity, and safer neighborhoods. On the next slide. Danielle, you can advance the slide if you can.
I don't know if my thing has frozen. Sorry, everybody. Hear me, Jackie?
Yeah, I can hear you. Can you hear me, Danielle?
I can hear you, but my computer may be frozen. The slide advanced. Do you see it advancing?
Yeah, the slide advanced. So we also
Okay.
want to share opportunities. I think it may have advanced a little too fast, but it's fine. So ultimately, you know, we each have a role to play as healthcare providers and as individuals to really address racism. This quote from Maya Angelou, I think, does a great job really summarizing why it's important, right? So she defines racism as the plague of racism. It's insidious, entering into our minds as smoothly and quietly and invisibly as floating airborne microbes enter into our bodies to find lifelong purchase in our bloodstreams. So we have an opportunity to do some prevention so that we don't continue to spread, socially transmit the disease of racism. And it's been a pleasure to speak with you, and we're looking forward to the conversation.
Thank you so much, Dr. Dooley and Dr. Douge, for that very helpful presentation, really setting the stage of understanding the definitions here, understanding that socio-ecological model that we're sort of working in and the complexities of all the different spaces this enters into. And then also touching on some initial thoughts on how we can individually as providers have impact in this area and some broader areas that we can as well. So thank you so much for that. I know that we have many comments about being able to access the information and the slides and the resources, so we will follow up with our members on that. And again, recording this evening for members to be able to refer back to that. So I'd like to jump in with some of the pre-submitted questions that we had from our members, and then again open it up for some further discussion. And I think I'll follow that socio-ecological model and maybe start with some questions around individual interactions that we have with patients and families, and then kind of move to some more broader questions that came up. And you both spoke to this very eloquently in the presentation, in that we all acknowledge that we have a very short time, typically in working with patients and families, whether we're in an acute care setting or in a primary care setting. You spoke to the importance of looking at evidence-based screening tools, the environment of our clinical spaces, and what is available in our waiting rooms and what children see and read around us. In addition to some of those thoughts, do you have any other suggestions of practice pearls that us as providers can take in terms of addressing racism as a social determinant of health?
So this is Jackie. I'll take a first stab at that question. I love something that I had a conversation with our colleague and friend, Dr. Maria Trent, about this work of being anti-racist in the practice. And I think it really comes down to, are we really being empathetic with our patients, right? I think most people want to know that you hear them, you see them, and you're trying to relate to what they're going through. So I think for on the most basic level, I think as providers, with the time that we have with our patients, really using that time and opportunity to show how interested we are and listening and watching body language and cues, right? And following up, delving in more, right? When someone brings up a question, if a child gets referred for a disciplinary reason, right? Or for behavior problems. And we know that certain communities of color are disproportionately impacted by being suspended or referred for behavioral problems, or even being referred because they may have attention deficit disorder, right? We might need to probe a little bit more, especially when our screening tools show that really there doesn't seem to be an indication for why this child may be referred. So I think we ask more probing questions, we're empathetic, and we listen, right? Those I think are really important tools. And that's for anything I think we do in terms of our practice.
Great. I'm feverishly taking some notes as well. Thank you. And sort of along the same guidelines, there's so many wonderful recommendations that are put forward in the policy statement. Are there any evidence-based guidelines or specific guidelines that as practitioners we can continue to follow to promote equity in our clinical practices, whether that be some of the screening tools you've mentioned or other strategies that we can consider?
Just gonna see if
Sure. Can you all hear me? I'm sorry, I'm having issues with my internet connection.
Yeah, we can hear you.
Okay, great. I think definitely the social determinants of health screening is key, simply because we know that due to historical and structural, racism in so many of our communities and in our country's history, that not all groups in our society have been given the opportunity, to live as healthily as others or have the same resources in their neighborhood as others. So I think, incorporating social determinants of health screening, even if you're starting, for example, with the 2-question food insecurity screening tool that's validated by the USDA, is a great place to start. And I think especially given the pandemic that's happening, that's an incredibly important thing to be asking all of our families in our practices, given the rise in unemployment and challenges that so many families are facing. So I think definitely, seeing how your practice is incorporating social determinants of health screening. Some practices are using doing screening for adverse childhood experiences. We have a group of about 6 clinics, and we have 2 of them that are piloting that right now. Some practices have also used the PRACY tool, or Perceived Racism by Children and Youth tool, in their practices. That came out in about 2010. There's a nice article on that, and the tool is available online. So thinking about ways you can, address those things in your practice. And then I think at the organizational level, really considering what are the offerings at the NAPNAP conference, for example, what offerings do you have to help members build skills in these areas or address these areas? We're certainly seeing so many more offerings along these lines for the AAP National Conference, which I think is really helpful to members.
Thank you so much. And it's a great point. And in preparing for tonight, I looked back through our conference agendas from the last few years, and definitely have had many talks, certainly on ACE screening and social determinants of health, and a lot more opportunity to do that, as well as examining our own biases in healthcare and how we can take the steps to do that more effectively. But certainly always opportunity to really focus our discussions on that further. I apologize, the lights went out in my office for a second. Wonderful. One of the things that I really really focused on in the policy statement was looking at health outcomes as they relate to racial disparities. And so, for example, if we look at, for example, infant mortality rate and the complications of low birth weight having been associated with perceived racial discrimination or maternal stress, for example, or even as we look at health outcomes that have resulted from whatever these health disparities may look like, as opposed to really reflecting on preventing and the prevention of some of the social conditions that have maybe led to that and sort of shifting that focus. And so thinking about those types of things, we had a very interesting question from a member. For example, knowing the data that African American women and infants may have poor health outcomes, whether that's related to mortality or whatever it may be, how do we think about addressing those types of things early on without offending, but rather supporting the data, but also trying to tackle those things a little bit more upstream?
I think it's a great question. And I think it starts with, you know, looking at the organizational or practice level, you know, how your organization or practice is, you know, positioned to support children and families so that all children and families have, you know, so that we can close the gap on these health disparities and, you know, improve outcomes for populations. I know, for example, in our community in Washington, D.C., and I know we have some of our D.C. colleagues on the line, you know, we've had a number of birth hospitals, for example, close over the past couple of years. So many people have been involved in a lot of community level advocacy to ensure that services are available and accessible to begin with for all populations in our city. So I think looking at that community level and then looking at your organizational and practice level, what do you offer at that level? For example, do you have integrated, you know, mental health care into your practice that is designed to help support children and families? We're fortunate at Children's, one of our colleagues, Dr. Lee Beers, who's president-elect of the American Academy of Pediatrics, is the co-founder of the Early Childhood Innovation Network, which you can visit their website at ecin.org. And that's really a community collaboration between health systems, our community partners and members to really build that, you know, scaffolding for early childhood so that there are mental health and parenting supports in place to help improve outcomes. And I think what's key is that it's really designed by the people who you know, will be using the services. So I think wherever you can incorporate that voice is so important.
Thank you so much. That's very, very helpful. You know, one of the things that I really appreciated about your presentation was reflecting on how we study all of the milestones around physical development, mental health development, social emotional development of children, and thinking about the trajectory of racial development, and when children start to notice those differences at a very young age, start to then think about those differences, start to develop those biases, and then internalize the biases as they grow older. And to your point of really trying to find that window of opportunity when they're very young to talk about that and to talk with them about what they're experiencing, what they're seeing, and what they're feeling. And so I wondered, kind of looking at the developmental trajectory, what additional pearls that you can share about bringing that subject up and how we might address that developmentally with different ages of children to understand the impact of racism that they may be feeling, whether that's as individuals or even bystanders to seeing what's happening around them.
So this is Jackie. So I think those are excellent questions, and a lot of some of that work, practices that are involved in Reach Out and Read. I think there are going to be more tools that are coming to sort of have that conversation, and why it's important that we not only are giving diverse books because of the importance of early childhood literacy, but also the fact that those books also provide other opportunities, right, in terms of health and well-being, in terms of if a child of color sees himself reflected in that book, that's a social emotional resource, right, a mental health resource down the line, because we know that kids who have a good sense of who they are in terms of their racial identity it's a protective factor over time. So in some ways, right, we're sort of, that's also a way that we're really making a difference. But I think more tools will be coming on really how do we incorporate that into the practice. And I think even Dr. Dooley mentioned that, you know, really need to, we're really in the process, like this is the beginning, right? This policy statement really solidifies our role as providers and really tackling this issue. And again, some of the suggestions, but we each really have to do the work as organizations to really create those additional tools and resources that we can really use for our practice and for and working with families and children.
Absolutely. I certainly see this as being one of those spaces where we learn from our patients and we learn from their stories and we learn from their experiences and helping us understand that a little bit better too, which is why we love pediatrics, right? This is an interesting question, a bit of a case study almost in thinking about a scenario where you may have, let's say, a 10-year-old school-aged African-American child who's adopted into a white family, who might show signs of being scared or confused about what that feels like and what they might be experiencing, and whose caregivers may be only addressing the issue or maybe even avoiding it because not really knowing how to sort of have that dialogue. So along the same vein, what would be a way to maybe approach that particular scenario?
So I think there are, you know, again, I think it sort of may start with having that dialogue with the, you know, patient and family. First of all, with one of the slides that Dr. Douge presented, you know, what does your practice look like? Have you created an environment that is welcoming to patients and families that are of diverse, you know, makeups, backgrounds, compositions, everything like that, so that you are showing that you are, you know, a welcoming environment. And then again, I think being willing to open the discussion with families of just, I am here to support you in your, you know, journey on addressing these issues in your family. What have maybe some of the conversations been so far, or what are the things you're finding hard to talk about, might be a way to address it with families.
Absolutely. And I see a comment from one of our members about diversifying our workforce, which I know you touched on as well, both in medicine and nursing. So we always talk about this sort of mirroring of our workforce with the diversity of the children in our world and in our country that we care for. And that certainly has come up, and I know it's a very important part of NAPNAP's, of our association's work, looking at workforce development in general, but also through the lens of diversity and how do we reach out and extend and welcome diversity in all forms to the work that we do. I really appreciated in the policy statement how the data that we have right now about concordance with respect to students and teachers and seeing the outcomes in terms of academic success when that concordance is met. And so thinking about our roles and diversifying our workforce so that we also potentially can see some of those outcomes in relating to our patients and understanding what they're going through. So I know it's something we're very committed to as we look at our workforce going forward and thinking about ways that we can help with that. So very intriguing. And as you can imagine, when we presented this topic last year in November, when we had our fall symposium in Washington, DC, and understandably, there's a lot of opportunity for research data to understand what that looks like and how we can find ways to do that. But I know there are many programs out there that are looking at that very carefully as well. So kind of along the same vein, it seems, you know, thinking through all of the different things we've spoken about, we have so many researchers in our association and those that like to ask a lot of questions. And so it seems like there's so much space to understand this issue more. In your experience, what do you feel are some of the more pressing research questions that address the effects of racism, and where do you see some of that that space being met right now in terms of the research that's being done?
Jackie, do you want to start or do you want me to?
I'm not really the researcher. I mean, I know where I think there there might be areas for more research, you know, looking at some of Nia's work, Dr. Nia Hergaris. I mean, you know, she looked at vicarious racism, but she also, a lot of the research that's done really leaves more questions, I think, than answers, right? So there are correlations between the impact of racism, and we know the physiological effects racism has. But I think down the line, I think there's going to need to be more research about interventions that are working, right, to really to decrease the health inequities. And I think looking at what really works in practice, right? What tools can be what standardized tools, similar to, you know, a PHQ-9, right? As you said, there's a PRACY, as you know, Dr. Dooley mentioned PRACY, but I think we really need to have what really works on the ground for different practices, so that we really know that they make a difference and they're moving the needle in terms of improving health outcomes. So that's my perspective.
I completely agree, and I think more research from the patient's perspective on what they want to hear from their pediatric providers, ways that the practice can support them, and also ways I think that we can really reinforce the tremendous strengths and resilience that so many of our families have, that so much of the positive cultural identity that so many of our families have, and how can we, you know, really as practitioners get to you know, working with families so that we're both recognizing and supporting their strengths. So I think a lot of research around sort of patient feedback on what they want from their experience. I'm also not sure if enough done to talk about, while we've certainly seen studies that really nicely illustrate some of the disparities in care offered to different populations, have we done enough research to illustrate and elevate the experience of different populations in our systems, you know, from their standpoint, I think is really important to hear.
Absolutely. That's definitely a great point. And sort of, you know, along the same vein, that the statement certainly speaks to opportunities for public policy and advocacy work. And one of the things that I think I've really appreciated in this discussion is really understanding that this is about healthcare, it's about education, it's about school access, it's about food and housing security, all of these different elements that are all the structures that sort of feed into it. And I think the statement really outlines well that legislative and advocacy opportunities in this space really touch on those things. What can we do as practitioners and advocates for children to really think about access to mental health care and making sure that children have appropriate and safe housing and food security? I wonder if there's some other spaces where you're seeing legislation and advocacy work come up in this.
Well, so I'll start. I think voting, right, in some ways is an indirect way to address the issue. So we look at voter suppression. So, and then there's really, you know, the American Academy of Pediatrics has put out a push for pediatric practices to encourage our patients to vote and register to vote. So I think that's an area, especially a relevant area now, that we can really get behind in terms of advocating. It doesn't matter what party affiliation, it's just knowing that we're exercising our rights to make change and really talk to our legislators about the change that's needed to improve kids' lives and families' lives.
Yeah, I definitely agree with Dr. Douge. I think one of the slides maybe you didn't get to see because of my computer freezing was that I think we can be tremendous advocates at our community level around, you know, has your community declared racism a public health crisis, and therefore is committing, dollars and efforts to address it. We have a bill that is before our DC City Council right now, requiring the council to undertake a racial equity lens examination of any new policy or proposal. So can you do that in your own community so that it looks at perhaps any unintended consequences of legislation, or groups that may be particularly harmed by that legislation, or is it going to help all groups equally? So I think those are other ways we can be advocates. I also think we're incredibly important partners with the education system. I think so many pediatric nurse practitioners and pediatric doctors, serve in school boards or provide some health guidance to schools or work with their school community, or maybe you're on the diversity and inclusion committee for your children's schools. I know Dr. Douge serves on that committee for all of the county in which her children were in school. So I think we bring a really important voice to try to help advance efforts at the education level to provide a more equitable experience for all students.
Absolutely, and I really appreciate taking a fresh perspective when we look at any policy. Really, you can look at it through many lenses, but doing that through this specific lens will hopefully at least start to ask the question early on, so that it's drafted and appropriate for a wide variety of populations looking at that. One of the things that I know we're all so passionate about, as you just mentioned, is certainly education, and we have many faculty and those that precept and inspire the next generation of practitioners coming forward. And so this last question is, are there suggestions for dialogue that we can include in our educational programs for advanced practice nursing that could be impactful not only for students to hear, but as they contemplate and consider these types of applications into practice? I think a lot about going through this pandemic that, for example, we're starting to use telehealth so much more exponentially than we did before, and we're building that now more into curriculum to really prepare students for the climate that they'll be practicing in. And along a similar vein, how do we best have this dialogue with students as they're training?
Dr. Douge, do you want to start, or do you want me to go?
I'll tag you in.
Okay. So I think that, so I am fortunate. First of all, I so appreciate the incredible role that you all play in training the next generation of child health providers. And I do teach a course at our GW School of Medicine called Patients, Populations, and Systems. And in the third, it's for all medical students. In the third semester of the course, we specifically have a whole module on racism in the healthcare system. And so I think really being, willing to kind of tackle that whole subject with your trainees is really important. We have a lecture that is given by Dr. Michael Knight, who's our Chief Quality and Safety Officer for the Medical Faculty Associates at GW, and he talks about the different levels of racism that patients experience in the healthcare system. Then we follow it up with a panel where we have both patients talking about, their experiences to help teach our trainees, but we also have colleagues talking about the racism that they have experienced, in this sort of in their practice and within the entire power structure of the university. So I think being deliberate about incorporating that into our trainees' education is really important, where people are willing, to do so. And then this year, for the first time, we're introducing a small group case discussion around that as well, so that the students can break into smaller groups and discuss some of these topics. So that's just a small way, but I think, being willing to sort of take that journey with our students is incredibly important, particularly if, we may be teaching white students who may not have had that experience in the healthcare system that others may have had, and, really need to be informed about how things they may do, may make it worse for patients.
Absolutely. And I just wanted to reflect on a comment in the chat box about a technique that somebody has used for just initiating the dialogue with nurse practitioner students of their own lived experiences, to your point, so that it just helps students see the different perspectives that maybe have not been brought to the table. I'm even thinking about the way that we're taught to present patients. And what we include in that sort of one-liner statement as we're discussing, backgrounds of patients and things like that, and opportunities to think about reflecting on that a little bit. Again, trying to remove sort of any kind of disparity and just representing the individual for their clinical symptoms and the care that we need to provide. So really interesting. Also, Monica,
I would just jump in on that point too. Like, our med school has guidelines for us in our, curricula on not putting race in the descriptor when we're writing these cases and things about patients, because so many times it is used negatively, as I think Ms. Ordway was saying, to really reinforce biases and things like that. So I think we can be advocates at our institution to, around the education that our trainees are getting.
And I would even just add real quickly, I think the bias-free language that Ms. Ordway mentions is like, the use in public health as well, right? And also in medicine, we use marginalized, underserved, underrepresented, minority, right? And they're all really negative compared to the normative of whiteness, right? And even how we talk about health disparities, right? I think in some ways when we talk about disparities, they're really health inequities, because in many of those instances, right, they were preventable disease outcomes, right? So, I mean, it's true, disparities really talk about differences, but we really want to get down to the root of it. They're really inequities. It's beyond unequal. It's about ways that, structural policies and systemic racism is set up to create these differences that lead to these outcomes, these poor health outcomes between groups.
Thank you. Well, we have some open time now for any additional questions that any members may have. If you wanted to write anything into the chat box, or certainly if you'd like to speak to provide any question or comment for our speakers or for each other. I'll give everyone a moment to respond. So there's a comment about bias-free language. Is there is mentioning this bad? Certainly appreciating that many cultures are proud, certainly, to be from certain countries and highlighting that. So it's also a balance of celebrating race and culture as well, and being very thoughtful about that as well. So I think that is a good point to bring forward. Thank you. Any other questions or comments from the group? There's a question of, is there a resource of how to use unbiased or less biased language that to share?
I think the one resource, Race in Medicine, that website, I think has some additional resources. But then I ultimately go back to the question, why is it, really rethinking what terminologies that we're using and why we're using those terminologies, right? So that's also kind of something. But I think that Race in Medicine resource might be helpful.
Okay, thank you.
And Dr. Rhea Boyd has a recent piece in Health Affairs that addresses this also, and using race in our sort of patient descriptors and where it can be helpful and where it can be sort of harmful in, you know, reaffirming biases against populations.
Okay, wonderful.
I would, I'm not sure people saw in the chat, but this is Monica Ordway, and we were actually talking about this. I'm the research chair for NAPNAP, and the APA manual, the new APA 7th edition manual, chapter 5, has some a great kind of explanation and conversation on bias-free language, whether it's to do with, you know, gender, disability, age, race, ethnicity. And then on the APA website, in addition to what's in the chapter, there are some nice examples of language and bias-free language.
Thank you so much, Monica. And we'll make sure, as Michelle has noted, to add all of the additional content to our Child Equity webpage for NAPNAP for our association, so we can continue to provide these resources as we learn more about them. Any other questions, comments, thoughts? Well, we have just about, I suppose, about 5 minutes left of our time this evening. And before kind of ending, I thought I might ask a final question. In the year that we've had with the pandemic and our discussion this evening, and a lot of uncertainty about what's going to happen, and we obviously want to continue to do everything we can for children and their health and well-being. I'm curious to ask both of you, what gives you hope in the work that you've done and sort of seeing the spaces that we can move to positively from this?
You want to start first, Danielle?
Sure. I mean, I think what gives me hope is my children, because they are 10 and 14, and it makes me hopeful that they, even though they're raised like in my house, they already see things so differently and have such a better understanding of white privilege that I don't even think I taught them, but I think like they have learned from their school and their community. And so I have a lot of hope that they already are, you know, white privilege was certainly not something I was taught about growing up. And so I have a lot of hope that they already seem so aware of how to, you know, navigate the world and contribute to a more equitable society. So that gives me a lot of hope. And, you know, it's coming from home where I'm spending so much of my time these days. I see patients 1 day a week. So all my other days are spent working from home. So I've had a lot of time around my children recently.
Understood. Dr. Douge?
And I think what's really giving me hope is, again, just this multi-ethnic, multicultural, multiracial, multi-gendered collective action, right? To say that Black Lives Matter, that we need to make a change, right? And it's not, and I think we have it's not just a moment, it's a movement now, right? And I'm hopeful based on that, especially young people leading the way gives me hope.
That's wonderful to hear. Thank you. And obviously we have all of our members here that are staunch child health advocates. And I think that really is what pushes us every day, as we know we're hopefully creating a future of informed and thoughtful individuals that will grow up and really lead us forward. So I just want to thank both of you so much. I know we're doing a virtual applause for you this evening. Thank you for your time, for sharing the statement and what we've learned from it. And we're so pleased to have had you this evening. And thank you to all of our members who joined us this evening for the town hall, for your thoughtful questions and dialogue. I think that there is so much more that our association can continue to do when we think about our conferences, when we think about providing additional tools in our clinical interactions, spaces for research, as well as our education efforts with future practitioners. So many more things to come. And again, appreciate both Dr. Dooley and Dr. Douge's expertise. Thank you, Michelle, at the National Office for pulling together the logistics and the technical aspects of the Zoom meeting as always. And wish you all continued health and well-being, and appreciate all of your attendance this evening. Thank you so much.